consent to being recorded. You can always drop off the line and just follow with me via email. I'll be happy to share any meeting notes that we have, get you acquainted with the topic, and get you connected with our speakers. So you can do so, but we'll also be happy to have you join us for today. We do have quite a few people on for our call today. So we're going to ask that you also get acquainted with us by dropping us a message in the chat box telling us where you're from and what position you hold within your public health department team or whatever capacity you're joining us from today. Okay. And on that note, Anna, I can turn it over to you so you can get started on your presentation. Thank you so much again for joining us today.
Yes. Thank you all so much for having us. This is great. All right, so today we will be sharing about mobilizing for action through planning and partnerships, or MAPP 2.0. Our objectives for this session are going to be to introduce you to the basics of the MAPP 2.0 framework for community health improvement, list the foundational principles of MAPP, describe the key phases and tools within the framework, and identify where you can find resources to conduct a MAPP 2.0 process. So starting with some just basic introduction to MAPP. MAPP stands for Mobilizing for Action Through Planning and Partnerships, and it is the National Association of County and City Health Officials' flagship framework for community health improvement. So it outlines a community-driven strategic planning process to improve public health and advance health equity. It helps communities prioritize public health issues, identify resources to address them, and take action through a shared community health improvement plan. Typically, MAPP is facilitated by community health leaders, like a health department, although it can be facilitated by others. And it provides a structure for communities to involve their broader local public health system and non-traditional community partners, meaning those outside of public health and healthcare, in that process of identifying and addressing community needs. MAPP 1.0 was originally developed in 2001, and from 2018 to 2019, NACCHO conducted a national evaluation of the original framework and identified opportunities to improve the framework. So that led us to our MAPP evolution process, which was from about 2019 to just last year, July 2023, where we worked with the field, including with field practitioners through subcommittees. We had a total of 10 health departments who participated in either pilot testing the assessments, as Lindsay from Eastern Band of Cherokee Indians and her colleagues did, and their community did, as well as other health departments who reviewed the guidance and provided us with feedback, with the goal of making the framework more community-driven, grounded in concepts of health equity, and less cumbersome. So for those of you who may be familiar with MAPP 1.0, or if you're new, this is just a summary slide of the major changes that have been made to the framework. MAPP 2.0 outlines the same general process of MAPP 1.0, from convening partners to conducting an assessment to developing and implementing a community or tribal health improvement plan. However, it includes much more detailed guidance, new tools and resources, and a greater focus on health equity. So for this side-by-side comparison that we have here, MAPP 1.0 included 6 phases, which have just been streamlined down into 3 kind of larger phases in MAPP 2.0, but encompassing all of the same major steps, and a few things sort of switched around or added in. MAPP 1.0 had 4 assessments, and MAPP 2.0 has 3 assessments. So the major change there is that the Forces of Change assessment, which was from MAPP 1.0, has now been sort of threaded as a theme throughout these 3 assessments in MAPP 2.0. And if you are familiar with the local public health systems assessment tool, if that was a tool that you used or had adapted, now we have a brand new community partner assessment tool. So that tool, is the local public health systems assessment, is no longer used in MAPP, but we kept the core themes of that tool that we knew from the field were helpful to that process of working with local public health system partners. The goal of MAPP 1.0 was to improve population health. And over the years, additional supplements were added to help communities focus on addressing equity in their CHI process. Now, MAPP 2.0 has health equity as the central goal. So it's no longer a supplement that's added, but it really is the core goal of the process and the framework. So therefore, the supplement that goes with MAPP 2.0 for those who want to go a step further is called the Power Primer. And that's a tool to help communities address power imbalances as a root cause of inequities. And we'll share a little bit about that later. So you can expect a similar process with much greater focus on community engagement and identifying and addressing inequities. So you might want to share, or maybe you would like to share in the chat, which changes between MAPP 1.0 and MAPP 2.0 are of greatest interest to you. And I'll continue on with our notes related to health equity. So as I said, the goal of MAPP 2.0 is to achieve health equity. And health equity is the assurance of the conditions for optimal health for all people. As seen in this image here, by centering equity, in this image distinguishes equality from equity, and then even further from justice and inclusion. So by centering equity, we're centering the idea that public health should provide each community member with what is needed for them to achieve health, rather than applying broad stroke solutions to improve health for some while excluding others. MAPP 2.0 centers health equity by encouraging meaningful engagement of community members, identifying inequities and their root causes, and implementing upstream actions that will address those root causes rather than only focusing on health outcomes or social determinants of health. The framework is grounded in these foundational principles, which were developed with the field with our MAPP Evolution Steering Committee. And these were developed in order to advance health equity through a community-driven process. So each of the changes to the framework are grounded in these 9 foundational principles. They articulate the guiding values of the MAPP redesign and illustrate a vision for community health improvement as a community-led continuous process to improve population health. Just to highlight some examples, MAPP 2.0 outlines an inclusive process that all in the community are invited to join and lead. It's a flexible process that can be adapted to a community's resources and needs and past experience with community health improvement, and helps communities implement full spectrum actions that target root causes, social determinants, and health outcomes. In developing MAPP 2.0, we really did aim to ensure that all revisions aligned with these principles. I thought that this was a good slide to note a change that we actually still have upcoming within the framework. So since MAPP 2.0 has been released and used in the field, we've learned from our partners in the field and health departments about, so we have the word stakeholder used often throughout the framework. We have a stakeholder analysis, which is a key tool, and it's used to describe those who are impacted by the process or who could have an impact on the process. But we have heard about and know about the negative origins of this word rooted in colonialism, and are exploring how we can use language that better meets the intent as far as working with those in the community as collaborators on the process and involving those who will be impacted by community health improvement and who can have an impact on the process, and using language that better reflects that. So just wanted to note that you'll see that in the tool that we have, the stakeholder analysis, and we'll talk about it a little again there too. Throughout MAPP 2.0, you'll see reference to the health equity action spectrum. So this was a tool that was created to outline the relationship between root causes, social determinants of health, and health outcomes and behaviors. So since the goal of MAPP 2.0 is to center health equity, we knew that from the field, we needed to provide more tools to help MAPP practitioners and their partners differentiate these concepts and put them into action. So this resource can be used to describe the relationship between these factors when working with local partners, help you identify indicators within your assessment across the spectrum. There are other tools to help you do that too, and help identify actions to take within the health improvement plan across this spectrum. You might also choose to adapt this graphic and create something for your community so that you have language in it that reflects how you all talk about health equity and health improvement. So this can be used as a starting point for a tool that you could adapt further. And additionally, on this thread of how health equity is threaded throughout the framework and is the cornerstone of the framework is this concept of community engagement and community power building. It's critical that MAPP 2.0 is a community engaged process to ensure that community needs and desires are what guide the process. It can also contribute to helping build community power by ensuring that community members are in positions of leadership over the process. So shown here is the spectrum of community engagement to ownership. This is from Community Commons, developed by Rosa Gonzalez from Facilitating Power. And it describes the difference between simply informing the community of what is happening within a process like MAPP to having that process be led by community members and having local organizations defer to the direction of community members. This is referenced throughout MAPP as a tool to evaluate how you have engaged community members in the past and to set goals for having the process be more community-led. So at the close to this brief section on health equity within MAPP, maybe you'd like to share or consider what principles of health equity resonate with you in your work from what I've just described. Please also feel free to add any questions or reactions or comments that you have to the chat as well. But in summary, these are the MAPP 2.0 materials. So we have the Handbook of Guidance, there's a starting point assessment tool that's separate, the 3 assessment tools, and the Power Primer that I'll talk about in a little bit, all available at NACCHO.org/MAPP. And we have a slide later to show you all the different resources available. But now I'll hand it over to my colleague Harper to provide an overview of the 3-phase process.
Great, thank you so much, Anna. We can go to the next slide. Oh, and I'm a slide behind. All right, we're going to talk about the MAPP 2.0 process. The graphic on the screen, it goes over the 3-phase process that is MAPP. The 3 phases are build the community health improvement foundation, 2 is tell the community story, and phase 3 is continually improve, sorry, I can't say the word today, continuously improve the community. And you'll see that there are arrows that depict that this process is continuous and it's not a linear approach. So you might refer back to previous phases throughout the process or begin a new MAPP cycle as we're wrapping up the previous cycle. So we're going to go through each phase, step, and tool of MAPP 2.0, and this overview will also include a brief review of the Power Primer. Next slide. Oh, you're ahead of me. Thank you. So we're going to talk about phase 1.
Yeah, every day of your life, you gotta eat.
And just, a reminder for you all, if you want to go ahead and click that mute button, that'd be great. All right, we're going to talk about phase 1. So the first phase of MAPP is phase 1, build the community health improvement foundation. The goals of this first phase are to involve community members who represent populations experiencing inequities to guide and participate in MAPP planning, build strategic relationships with new and existing partners to engage throughout MAPP, establish the MAPP core group and steering committee that represent the community, develop a shared understanding of MAPP and the community's vision for the future, evaluate what resources are available and needed to achieve MAPP's goals effectively, and finally, create work groups to build infrastructure for CHI, which is community health improvement. We can also go to the next slide. Great, so now I'd like to highlight 2 of the key tools used in phase 1. The first is the stakeholder and power analysis. This is the very first step of MAPP 2.0. And the goals of this are to understand the characteristics of all who will be impacted by or could have an impact on the community health improvement efforts. And to also use the information you gather about stakeholders to identify and build new relationships within organizations and community members. So this is intentionally the very first step of MAPP so that you can intentionally include community members and partners broadly in the MAPP process with an understanding of what influence they may have over the process. And like we mentioned earlier, I know you're seeing that word stakeholder on the screen again. Like we mentioned, we're in the process of using alternative words to stakeholder in our materials For example, one project I'm working on, we are using partners as the word to replace stakeholder. So we also want to, you know, get your feedback. If you have any thoughts on the use of this word, feel free to pop them in the chat. You can also email us or, you know, bring it up during our Q&A session today. So we appreciate any thoughts you have on this while nature goes through a change. And next slide, please. All right, another key tool within phase one is the starting point assessment. The purpose of the starting point assessment is for those leading the MAPP process to reflect on their last community health improvement cycle, identify resources available for the current cycle, and create goals for the current cycle. And the tool explores the following topic areas. So we have a general reflection on the last cycle, including, you know, what went well, what did not go well. We have how the community was engaged in the past cycle and how they could be better engaged in this cycle. The landscape of partners who have been involved in the past and what they contributed to MAPP, and opportunities for improvement in diversifying partnerships. Another topic area is a look at the data collected in the last community health assessment and opportunities to better assess root causes of health inequity and social determinants of health. There's also an analysis of the last community health improvement plan and to what extent the goals and objectives were met, as well as how many addressed health outcomes, social determinants of health, or root causes of inequity. Another topic area would be leadership support that's available to intentionally address health equity through the process. And then finally, an inventory of resources, skills, and materials that are available in the current cycle. So this is overall a continuous quality improvement process to help your community improve how community health improvement is facilitated. All right. Oh, and next slide. You're so good at this. Thanks. No, you're good. We're going to move on now to phase two. Tell the community story. This emphasizes the need for complete, accurate, and timely understanding of community health and well-being across all subpopulations within the community. So this phase really guides communities through a CHNA, or Community Health Needs Assessment, and it's done through an array of views ranging from health outcomes to root causes of those outcomes. And the goals of this phase, you'll see them on the screen, but I'll just read them for our group here today. They are to engage the community in developing a comprehensive and timely community health needs assessment, and identify the top population health priorities and health inequities in the community, including their root causes. Next slide, please. Great. So in this phase, the three assessments are done, and they are the Community Partner Assessment, or CPA, which is an assessment of the local public health system itself. Next, we have the Community Status Assessment, or CSA, which is a quantitative assessment of the community's health. And finally, we have the Community Context Assessment, also referred to as CCA, which is a qualitative assessment to gather community members' perspectives. And these assessments are analyzed together to tell a comprehensive story of the community's health. And next slide, perfect. So we'll talk a little bit more in detail now about them. So the first is the Community Partner Assessment, or CPA. It is the new partner assessment in MAPP 2.0. So it's replacing the use of the local public health systems assessment that was in MAPP 1.0. The CPA allows community partners involved in MAPP to look critically at their individual systems, processes, and capacities, and collect capacity as a network of community partners to address health inequities. So it helps to answer also the following questions, including what capacity, skills, and strengths does each organization involved in MAPP bring that can contribute to improving community health and advancing the MAPP goals? Who is involved in MAPP? And who else needs to be involved? So the CPA includes a survey of partners and a short series of meetings to discuss the findings and also opportunities to improve the local public health system. All right, and now we're going to talk about the Community Status Assessment, or CSI, which I previously mentioned is a quantitative assessment measuring the community's health status. So it really assesses health behaviors and outcomes, social determinants of health, and systems of power, privilege, and oppression. And then you'll see the arrow at the bottom that across these, you know, we're looking at health inequities. And the CSA helps answer the following questions. So what does the status of your community look like, including health, socioeconomic, environmental, and quality of life outcomes? What populations experience inequities across health, socioeconomic, environmental, and quality of life outcomes? And finally, how do systems influence outcomes? So the CSA, or the Community Status Assessment, uses quantitative methods such as survey, existing secondary quantitative data, and observational data. Great. And finally, we will talk about the Community Context Assessment, or the CCA, which is a qualitative assessment of the insights, expertise, and views of community members. So it explores the community's strengths and assets, forces of change, and the built environment. And the information can be used to provide context to the quantitative data gathered through the community status assessment. So the community context assessment, it helps us answer a few questions. So what strengths and resources does the community have that support health and well-being? What current and historical forces of change locally, regionally, and globally shape political, economic, and social conditions for community members? What physical and cultural assets are in the built environment? How do these vary by neighborhood? And finally, what is the community doing to improve health outcomes? What solutions has the community identified to improve community health? So the community context assessment includes qualitative methods such as focus groups, key informant interviews, walking or windshield tours, document review, asset mapping, and a whole lot more. So that's a brief overview of the community context assessment. And now we will talk about data triangulation. So after completing those 3 assessments, the data is triangulated to identify themes and issue statements. So the goal of this is to identify cross-cutting themes and develop a full understanding of the community, and to collectively interpret findings and cross-cutting themes to develop issue statements that reflect the issues faced by the community. Next slide, please. All right, and we are on to the final phase, phase 3. So this phase is centered on developing the Community Health Improvement Plan, or CHIP. The purpose of the CHIP is to address public health issues based on the results of the Community Health Needs Assessment from phases 1 and 2. This plan is used in collaboration with community partners to set priorities, coordinate actions, and target resources. It will also further define the vision established in phase 1. So the goals of this phase are to identify strategic priorities for CHIP across the health equity action spectrum that meet community needs, strategically align partner or organizations to priority issues by developing priority issue subcommittees, develop shared measures to track CHIP activities across partners, develop an action plan to achieve the community vision and map those goals effectively, and do continuous quality improvement on strategies as they are carried out. And I am now going to turn things back over to Anna to wrap up this portion of today's call.
Thanks, Harper. So that concludes our review of the handbook as far as the 3-phase process. So as mentioned before, a health equity supplement was added to MAPP 1.0 to help communities advance equity through the process. But now, with health equity as the goal of MAPP 2.0, the supplement that's provided instead is a power primer to dive deeper into addressing power as you conduct MAPP. So as stated by Dr. Martin Luther King Jr., power properly understood is nothing but the ability to achieve purpose. It is the strength required to bring about social, political, and economic change. Many MAPP communities are building collective power to improve community health and well-being by creating shared decision-making processes within MAPP. And there's growing focus on how to unite community partners on equitable terms to achieve collective goals for health. By using MAPP to guide your community health improvement process, you'll be partnering with and strategizing with communities disproportionately impacted by health inequities. NACCHO acknowledges that societal power imbalances are a root cause of health inequities, and there was interest from the field in having a resource to specifically explore this and address power in the process of MAPP, as well as power as a root cause of inequities. So specifically, this power primer explains why and how to address power dynamics within MAPP, acknowledge societal power imbalances as a root cause of health inequities, and support building community power through MAPP and community health improvement. This tool might not be right for every community right now, as many are likely to still be growing in their collective understanding and exploration of what it looks like to identify and address inequities. But it's intended for those facilitating MAPP who are already familiar with concepts related to health equity and who want to deepen their knowledge and practice of addressing power within their CHI process, and who are ready to embark on a learning process together. So now that you've been introduced to the different pieces of MAPP, which do you think that you would be most interested in adapting or changing? Maybe you'd like to share with us in the chat. You can download all of the MAPP 2.0 materials and access these additional resources at NACCHO.org/MAPP. So those include the handbook and additional tools that will help you complete the steps successfully. We also invite you to join the MAPP Network, which is an online resource where you can connect with other communities implementing MAPP and post and share your questions and responses to other questions. And on the MAPP Network, we also have 11 pre-recorded trainings for each phase, assessment, and major tool of the process. Lastly, I'll note you can also access this from our website. We have some regional trainings coming up that are open to any registrants from anywhere. We have about 60 spots in each, and I know we definitely have a lot left in Albuquerque, New Mexico. We have about 35 spots left in Cleveland, and I think about 20 spots left in Portland. So you can register for those at NACCHO.org/MAPP. Now I'm going to hand it over to Lindsay Henderson from Eastern Band of Cherokee Indians, Public Health and Human Services. As Lindsay and we had mentioned before, Eastern Band of Cherokee Indians was one of our pilot test sites for the new assessments, and one of only 2 of our sites who decided to implement all 3 assessments in about a 3 to 4 month process, and gave us extremely helpful feedback to update the framework, and has been very generous in sharing their learnings from that process. So we invited Lindsay to share today about their experience, and I believe she'll be focusing on the community partner assessment. So take it away, Lindsay.
Good afternoon, everybody. Can you guys hear me okay?
Yep, sounds good.
Good. Thank you for the introduction, Anna. So we did complete all 3 assessments in a very short amount of time, but today I really want to talk to you about the community partner assessment. But before we get started on that, I do want to give a brief introduction to who and what EBCI is. So if you'll do the next slide, please. Thank you. So the Eastern Band of Cherokee Indians is the only federally recognized tribe in the state of North Carolina, and we have approximately 16,500 enrolled members. So the Eastern Band of Cherokee Indians lies in the Great Smoky Mountains, and the tribal land spans across about 57,000 acres of largely rural mountain terrain, and the primary tribal lands are called the Qualla Boundary, and they span across a couple of different counties. If you'll see that larger yellow spot close to our tribal seal, that is the majority of our tribal lands in Jackson and Swain counties. But we also have land spread throughout the rest of the region, as you'll see there. We have our tribal seal, and then just a beautiful picture of Western North Carolina. If you'll go to the next slide, please. So the community partner assessment was really fun for us. It was one of the first in-person meetings that we had after COVID. So it was a really great way for us to connect with each other in person again. I'll just talk a little bit about how we designed the partner assessment, some of the activities that we did, and kind of what we got out of this assessment. So the community partner assessment's original design was a 2-day session or meeting. We did consult with NACCHO and shorten the meeting to half a day without losing the essence of the assessment by pulling agenda items that we felt were most important. And so it was very fast-paced, but we had to acknowledge that being back in person, we didn't want people to be around each other for an extended period of time. And being back in person, we all had very busy schedules. So what we focused on was developing a shared working definition of health equity, aligning agency activities to essential public health services, and mapping EBCI's local public health system with health improvement priorities. So our participants included our Public Health and Human Services Division, Jackson County Health Department, our school system, our legal aid office, and our local hospital system. And we began the meeting with the icebreaker question: what's one thing about Cherokee or your community that you're proud of? And I really love this question because it started off the meeting on a positive note, but also kind of primed participants to think about their community strengths and their relationships. You guys have any questions so far? I guess you can put them in the chat. Yeah. And I don't have a slide in particular to the health equity definition, but the definition that was read off earlier is what we displayed to use. And we did add a few things to that definition out of the group, and that was to complement and adjust our health systems to meet community needs. Health equity also could mean to us that our services and systems are patient-centered, that they're safe and accessible, so and non-judgmental, and that we want to involve the community in how we provide health care and really engage with them. If you'll move on to the next slide, please. So the 10 essential public health services were introduced to the group with 2 key questions in mind, and those are up here on the slide for you to view. But those are: what are the activities, competencies, and capacities of our local public health system, and what's going on in our local public health system, and how are the 10 essential public health services being provided to the community? Another way to put it: what are we doing to better the public's health? And so the goal was for participating agencies to see that they are part of our local public health system and how they fit into it. Sometimes the people that we work with don't realize the significance of their role in public health. And so you can go ahead and go to the next slide if you don't care, and I'll kind of talk through this. So what we did is I wrote out on some large sticky notes just the topics of the 10 public health services, and I gave each participant, or participant, a stack of color-coded sticky notes. So you'll see the furthest picture on the right. So each agency is color-coded, and then you'll see up there that they are able to, basically what we did is they wrote their activities related to assessment. So in the colors, you'll be able to see who said what. And so it was very interactive for them to be able to get up there and look at what others were doing and see how they were contributing to the essential public health services as well. If you'll go to the next slide, please. So part of this meeting was the Rich Picture activity. And anytime, I'm sorry, I put my paper in front of the camera. Anytime I get a chance to talk about the rich picture activity, I do, because this is such a great tool for communities to do together. So I'll talk about this for a second. This was the slide that we used as part of that meeting that day. And so we wanted to know how community members navigate our local public health system. And so what we wanted to do was make a collaborative picture of someone who is trying to navigate the system and see what shapes people's experiences around certain health priorities. And so what we did was we started with the issue at the center, and we considered policies, people, places, relationships, organizations, health outcomes, root causes, all those things that contribute to a health priority. And what we did is we asked them to use pictures, words, phrases, lines to draw out and connect those relationships. So if you'll go to the next slide, please. So we focused on 4 of our top health priorities that are used in our tribal health improvement process, and that is social, economic, and environmental factors, substance use, mental health and well-being, and violence and abuse. And there are a couple of different colors, and they do have meanings. So the green we used for what is positively or what is helping the community in relation to that health priority. Red, things that are negatively impacting, or in other words, maybe hurting the community as far as it goes relating to this health topic. And then some of in here, you'll see like an orangey yellow color. And those are things that we're not quite sure where it fits in, but we know it is contributing to this health priority. We really would have loved a few pictures on here, but we know that people get picture and drawing shy. So words and phrases are fine. And in that violence and abuse, you'll see a couple of extra lines that shows how different things network and connect and map out. And it was really beautiful just to see how all of these connections come through. And you'll see that throughout here, there are several things that are common or similar between all 4 of these priorities. And I will say that these results were, I'm sorry. And these results were later shared at one of our community tribal health improvement process meetings. And they really love this. So we, at the next meeting, gave them an opportunity to add on to this. So I will say, if you end up doing this activity, save these pieces of papers or be able to replicate them. That way people can add on to them. It's a very good, these are our tribal health improvement priorities. So they were part of our tribal health assessment. I'm sorry, but yeah, this is a great way to add on and to see and to get people interactive, especially for people who are sometimes share or shy to share their voices. This is a great way for them to interact and get their thoughts out as well. If you'll go to the next slide, please. So then participants were then asked to complete the community partner assessment survey, and our core public health team tailored the survey questions to represent our tribal community. So basically, we just included language that was inclusive of our community. For example, there's a question that talks about who we report to, and it was very interesting because 100% of respondents said that they reported to the tribal government and community members. So we did add that tribal government piece. And But this was a really great way for us to look at and see what our community partners are doing and who they report to, who they serve, and what their priorities are and how those align with public health. And if you'll go to the last slide, please. And just in conclusion, the Community Partner Assessment was a valuable tool that informed our Tribal Health Improvement Steering Committee and our community meetings. Building and maintaining relationships within the community networks really advances community health improvement goals, especially since our audiences and priorities closely align. And together, we can leverage our strengths and grow in areas where there are gaps in services and programming. And that is all I have.
Thank you so much, Lindsay. We're so thankful that you were willing to join us today to present about your all's experience with the assessments, in particular the community partner assessment. So at this point, we would just welcome any questions that you all have about MAPP, about Eastern Band of Cherokee Indians experience, or if you would like to share any comments or reactions that you have to anything you've learned about MAPP 2.0 today.
Anyone have any questions or comments?
Well, if not now, but if you do have any in the future, please do reach out to us with your questions. We would love to help you with implementing MAPP 2.0, adapting MAPP 2.0 as you're interested. You're welcome to email us at, let me put it here, map@naccho.org is sort of our general MAPP inbox. And my email address is aclayton@naccho.org. So please do reach out with any questions that you have. We also love to hear about how communities are implementing MAPP differently. So please feel free to reach out if you'd like to share anything you're learning from your process that you'd like to share. But thank you again, and thank you, Jessica, for having us.
Yes, thank you. And I do have a question. It's just something that I've kind of seen with the tribes that we've had the honor to work with. Is where several of them are currently either in the process of completing a community health assessment, or they're preparing to complete a community health assessment, and they're trying to decipher what steps they should take when it comes to completing those activities. So I guess my question is more so for Lindsay. I'm just wondering, how did MAPP 2.0 help you align your priorities with completing those activities, and did it make it any easier for your team to complete?
Okay. Absolutely, it made things easier. So fortunately, EBCI, Public Health and Human Services, has done tribal health assessments before, but we were kind of in the phase to our new cycle, essentially. And this was the first time that I was able to help facilitate that. And so these tools were really helpful to kind of get me started, and to see who all I could involve in that way. As far as the other assessments goes, it also gave us a really good opportunity to kind of dive in to those to data indicators, and also I really just want to emphasize that community and relationship building. We did the context, I think it was the context assessment, where we had a focus group with the community, and that was really nice to be able to hear their voices. That is so important to us. We also kind of have a timeline and I guess a checklist of things that we use to be able to facilitate our tribal health assessment and our tribal health improvement processes. And I can see about sharing that with you guys if you're interested.
Thank you so much. So for I know you mentioned that you completed all 3 assessments within about 3 months. Is that correct? Which portion, which portion was allotted the most time, or which one had the most challenges or hurdles that you had to overcome, or what took most time?
Oh, I think they all went really smoothly, because I had a great team to work with, and I was constantly reaching out to Anna and the NACCHO team for help. Um, I will say that the status assessment probably will take the most work because it is that data. It's that data dive. Thankfully, we have an epidemiologist on our team, so that's an advantage that we have. And what we did was we took those indicators related to priorities, we took them to our steering committee, and we spent a day going through those and basically drilling down into those top indicators that we would use for our tribal health improvement process. And that took, public health, the core team, there's about 3 or 4 of us, but our steering committee, who we took this meeting to and the data to, and to drill down on that too, it was a room full of people, and it did take about a day to go through there. And what was really, I think, beautiful out of it is we started with 3 priorities, and out of that meeting, we actually came up with a fourth indicator. We added that social, economic, and environmental factors priority team.
Okay, and we also have a comment, well, a question in the chat box about your public health accreditation status. Where are you guys currently in your journey to accreditation?
We are waiting to hear back the status of our accreditation. So we do not know yet.
Y'all got it. Fingers crossed. Y'all are amazing.
Thank you.
Really
Yeah.
great work.
We have our fingers crossed too.
Yeah, we look forward to celebrating.
Thank you so much.
Okay, any additional comments or questions? We have one attendee that's going through reaccreditation. I'm not sure how to pronounce your name, so please forgive me if I say it wrong. Is it Delia? Delia?
It's Delia. It's okay.
Delia, sorry.
Yeah, no worries. Yeah. So I just wanted to see if they were accredited on that, and yes. So
I
Awesome.
just use my email on a direct message so we can chat.
awesome. Thank you.
Yeah.
And Delia, have you used MAPP 1.0 for your activities?
We used MAPP 1.0 for the first accreditation that was done 5 years ago, and we're using MAPP 2.0 for the reaccreditation.
Awesome. And how was your journey?
It is interesting. I mean, I'm new to the position, so it's just interesting. You know, it takes a lot of manpower to collect the data, and we had some help, but we identified our priorities. We're currently in going to start our chip, so we kind of look for that.
Awesome. Thank you so much for sharing. So glad you joined us. Okay. Last call for questions or comments. Anyone else using MAPP 2.0? I can tell you one thing, the updated manual is beautiful. It's very beautiful. I can tell you guys put a lot of hard work into it. So we're looking forward to possibly utilizing some of the components that you've incorporated to even some of our team building activities. So hopefully I can get to one of those trainings.
That would be great. There were a lot of hands involved in developing the updated framework. So we're glad that people are using it. And I'll say, please do take a look, if you're interested, for anyone, take a look at those broader resources that do kind of an overview of each phase. Just get familiar with what the steps are and know that the handbook has very detailed step-by-step guidance, but you can always zoom out and kind of take a look at the goals for each step and then implement it differently than how it's outlined in the handbook. But just know that the more detailed guidance is there to fall back on and to use, but it can always be adapted as well.
Thank you. Okay, so if we don't have any additional questions or comments, I do want to thank our guest presenters for this afternoon, Anna, Harper, and Lindsay. Thank you so much for joining us. I'm so grateful that you've been able to share this resource as well as some of your experiences. This is what we love to do in TALC, is be able to share out those good frameworks and toolkits and information that can make our jobs a lot easier and also help us provide better services for the communities that we serve. So we're forever grateful for you being able to join us and assist us in that. Okay, after our session today, you will receive an evaluation sheet. I'll be sure to follow up with Anna and Lindsay as well to get the presentation materials and make sure everyone has them. If you would like to reach out to me regarding any technical assistance requests, if you have any topics that you'd like to share for our next talk, we'll be deep diving into community health assessments, and we'll also have another guest speaker who's pending, so I won't release that topic yet, but look for our announcement so you can see who'll be joining us. And on that note, I will bid everyone a great afternoon. I look forward to seeing you on our next talk.